So I specialize in really all aspects of adult and pediatric otolaryngology, so ear, nose, and throat, medical treatments and surgeries. So I've always enjoyed medicine and, kind of body function and that sort of thing in general. And then, becoming a physician was not necessarily something I dreamed of being growing up, but it was certainly something that I, looked towards early on. And so I just think I enjoy helping folks and, trying to understand why our bodies are not working the way we want them to, and then understanding how to fix them. It's a little bit like being a really highly specialized mechanic somewhat, and I've always enjoyed that aspect of things. So that was really the big, draw to me growing up was, how to interact with patients and their medical issues to fix them. So it just seemed kind of a natural fit. I think the things that I enjoy most about the job are really the interactions with the patients, and not just the patients that have a good outcome, but taking people through difficult times, and then coming out on the other end of a disease or a treatment or a surgery with them, and kind of getting to enjoy the results with them as well. I think that's very rewarding as a physician for most people, and then also just the interpersonal relationships you develop with patients and their families. I mean, for some of these people, we really do become a part of their family to some extent, and treating them and caring for them. So I think that's very rewarding, especially, being early in my career. I really enjoy that part of it. One of my big philosophies on treating patients is really having the patients understand and learn about their disease process, instead of just treating, here's a medicine, here's a treatment, here's what we're going to do. Try to get them to buy into understanding and learning about it themselves, and really having them treat themselves. And I think people do a lot better fundamentally if they understand the basis of what we're doing. So I try to spend a little more time in the office with people, teaching about the problem rather than just, treating it and moving along. I think the biggest reason I liked, the setup at Premier was a little bit of a larger group aspect. And so, as opposed to, being in a solo practice where you're working by yourself, I think we have a nice advantage of having, multiple partners, multiple different specialists within one group setting, which allows us to really provide patients in general with all aspects of care, not only with ENT, but with ophthalmology as well, being in the same group under one heading. And it lets us, get people in with certain specialty kind of things a little easier than we would otherwise. I think that's one of the advantages of having a larger group in general for patient care. So that was a big advantage for Premier to me.